So what is ST segment? ST segment is an interval between the end of the QRS complex, that is the J point or the ST junction, and the beginning of the T wave. In the limb leads, ST segment is isoelectric in about 75% of normal levels, and ST segment elevation or depression up to 0.1 millivolts generally is considered within normal limits. The ST segment elevation is more common and is usually present in the inferior leads, and ST segment depression seldom is seen in the leads 1, 2 or AVF because ST vector in the frontal plane, if present, is directed inferiorly. So if then it is present, it will be directly inferior. And in the precordial leads, some ST segment elevation is seen in more than 90% of normal subjects. The magnitude of the ST segment elevation is usually proportional to the QRS amplitude. So therefore it tends to be somewhere greater in men than in women. Particularly in young individuals, it will be seen more. And the elevation is most prominent up to 0.3 or more in leads V2 and V3. So in the left precordial, this elevation rarely exceeds 0.1 millivolts. Okay, so left precordial is the ST elevation exceeding 0.2 millivolts is uncommon in subjects older than 40 years. However, in body surface maps with 150 torso electrodes, maximum ST voltage is at 40 milliseconds into the ST segment averaged 0.2 millivolts, which was nearly twice as much as ST segment voltage sensed by the 6 standard precordial electrodes. Any ST segment depression in the precordial leads is considered abnormal, as the normal ST vector in the horizontal plane is directed anteriorly and upwards. In the posterior leads V7 to V9, prevalence of the ST segment elevation of 0.5 to 1 mm at 80 milliseconds after J point is in normal young men was 8.9% in lead V7, 5.8% in lead V8, and 3.1% in lead V9. Okay, thank you.